start there, but we're going to talk all about this CoolSculpting because a lot of people are very interested in it for weight loss. It's good to see you.
Great to be here. Thank you.
Yeah. I think this is really starting to catch on now, isn't it? You're seeing it more and more.
Yes, yes.
Tell us what it is and how it can help people who have that stubborn fat.
Yeah, well, CoolSculpting is a new non-invasive, non-surgical procedure that's used to get rid of that problematic fat, and it's using a new FDA-cleared cooling technology. And so it eliminates fat without any downtime.
Right, so this isn't surgery, this isn't lipo, this isn't anything like that. And it's sort of a machine, we're going to look at some video in a moment, it's sort of a machine that you sit with on that area, right?
Yes, you just come into the office, we put the machine on the area that we're going to target. It sucks the area into this little cup-like device, and it starts freezing the fat. And there's really no pain associated with it. And you just sit there for an hour per area. You can get on your iPod or iPhone, or bring your...
Or take a nap.
Yeah, or take a nap, read a magazine. It's pretty simple.
Very good. Now, what areas are we talking about is this commonly used for?
Well, it's for people that are generally fit, that have problem areas that are diet resistant and exercise resistant, such as the flanks, the love handles, the muffin top, belly fat, and we have other areas that patients have used it on. And it's great because it just targets those one areas that you can't get rid of.
Right. So it's someone who's tried.
Yes.
You know, they do have a regular good diet and exercise, but it's just some of those problem areas that maybe just won't go away.
Just won't go away, and you can be thin as can be, but that one area just won't go away.
Okay. I think everybody asks, okay, it sucks that fat into the machine, but then where does that fat go later, like through your body?
Well, we have a video, and it shows that it crystallizes the fat, and it slowly is eliminated from the body over a period of time. And in about 3 weeks, you'll start seeing some result, but at 2 to 3 months, you'll have your maximum effect, and you'll see your maximum results. So, say you're getting ready for the summer, or your bride getting ready for the summer, you need to go ahead and get it done now, so you'll be ready for the summer.
So you said in a few weeks you'll notice some difference, but it's really that 3 month.
3 months, 2 to 3 month period.
Okay,
yes.
What is this showing?
This is just showing how the fat is eliminated, and you have the bulge there, and after the bulge is eliminated, you'll have that new contour there.
Right. No damage to surrounding skin or vessels or anything?
Right. What's nice about the CoolSculpting procedure, it targets only fat cells, and so it doesn't damage the surrounding area, so the surrounding skin, the surrounding blood vessels and nerves are not damaged or touched, and there's no break in the skin also, so there's no risk of burning or anything like that.
Very good. Here's a few examples, and tell us about this patient.
This patient had CoolSculpting of their tummy, and you can see their bulge is much, much better. You can see there's even a little fold at the bottom, and on the after pictures there's not one.
Right, right. So a flatter tummy.
Flatter tummy.
Do we have another picture to show?
Yes, and you can see from the side the bulge is gone. So it gives pretty dramatic results.
Yeah, I could almost see a little muscle tone. It's not there on the left-hand side, and then a fold around the back as well.
Yes, it's gone. It's great because it really gets you jump-started, especially if you get sort of discouraged about losing that little spot and you've diet and exercise and it's gone. Well, it even jump-starts you even more to really get into that exercising and diet also.
Right. Oh, yeah, because you need something to kind of get you over that hump sometimes, or see improvement in one area, and then you're better about the rest. Can you just do one area at a time, or? Well,
actually, you can do several areas. If you want to do your tummy and your flanks or love handles, you can do that all at one time. It's just an hour per area.
Okay.
So it may take a couple hours if we're doing your flanks, one side and then the other side. Or for your tummy, maybe 3 hours. But you're sitting there and you can do, like I said, whatever you'd like to do while you're waiting.
Okay, you're not limited to just that one spot if you want to do more. And most people go back to work or whatever they have to do that day?
Well, that's really great because it's non-invasive. There's no downtime. You just have the procedure and you can go right back to work.
Do you tell them anything like drink lots of fluids, or are there any kind of special instructions?
Really, there's not. Afterwards, when we take the machine off, we massage the area. We ask the patients to sometimes wear a Spanx, which helps with some of the skin retraction. And we do ask patients to stay on a good diet and exercise program and go ahead and you can drink water, but you can go back and exercise that day or do whatever you want.
You tell even the guys to wear Spanx?
Well, sometimes we will. And sometimes it makes them feel like, oh, get them started.
Exactly. This is what you women have been putting up with all these years. But if that's better for their recovery procedure, then that's maybe a good idea.
Or they can put one of those shirts that have a tight fit. So.
Okay, very good. So if someone's interested, should they just call ahead, go to your website, or
Well,
what
we
would you
actually
suggest?
have a special event that we're going to have on March the 7th. It's going to be from 10 to 5, and we're actually going to ask people to call in and register for the event. But we're also going to have a door prize of a whole CoolSculpting procedure worth $1,400.
Right.
So
good.
come for the event and register for the door prize, and also we're going to have special event pricing that day.
Okay.
So yeah, come to the event. We'll be able to talk about it, give you more information, and then you can also just call us and make an appointment too.
Okay, so to go find out everything, will you have somebody getting it done? I know you've done that in the past at the time, but maybe go volunteer. You never know. DrSuzanneYee.com is the website, and of course you can find her out there on Cantor Road. There's the phone number to call for more information about the event, which is again is March
the 7th.
The 7th, coming up later this week. Okay, thank you, Dr. Yee. Appreciate it. Coming up.